Growing confusion over the COVID vaccine. Major pharmacies across the country now limiting some access to the vaccine in certain states, even as COVID cases are on the rise. This as the CDC is in turmoil after Health Secretary RFK Jr. fired CDC head Susan Monarez for not aligning with the department's overhaul in vaccine policy. ABC's senior White House correspondent Selena Wang is in Washington with the latest.
Hey, Perry, depending on where you live, it is now harder to get a COVID vaccine shot. Changes to the country's vaccine policy are fueling turmoil at the CDC. Now, just as new vaccines are rolling out to pharmacies across the country, CVS announces it will limit access to the shot in 16 states, requiring prescriptions in 13 others, including New York, Florida, and Colorado, and simply not offering it in 3 states. Now, Walgreens says they'll give vaccines in states where we are able to do so. This comes just days after the FDA approved the new COVID vaccine for this fall, but only for Americans over 65 and adults and younger people at high risk. Now, a critical CDC panel is not expected to give their recommendation for several more weeks. Now, the White House insists that the vaccine will still be available for all Americans who want it, but pressed on whether insurance will continue to cover it, the White House is sidestepping. Now, again, this comes as RFK Jr., the health secretary, has been pushing major changes to the nation's vaccine policy. This week, he moved to oust the head of the CDC, Susan Monarez, when she refused to get on board with his changes. Her lawyers say she, quote, refused to rubber stamp unscientific, reckless directives and fire dedicated health experts. But RFK Jr. is charging ahead, naming his deputy Jim O'Neill as the interim director of the CDC. This is someone who has said he supports vaccines, but not vaccine mandates. And right now, as COVID cases are already ticking up and as the winter season approaches, some medical groups are warning against putting limits on who can get the shot, saying it could have dangerous consequences. Perry?
Selena Wang, thank you for that report. And joining me now is Democratic Congressman Bera. He represents California's 6th congressional district. He's also a doctor who has served as the chief medical officer for Sacramento County. Congressman, thank you for joining us. So what do you say to the millions of Americans looking for guidance right now from the CDC?
You know, I'd say what RFK Jr. has done is putting all of us at risk. Now, without scientific evidence and the folks that he's putting in place, it's going to be hard for us to follow CDC recommendations. I would urge Americans to go talk to their doctors. And again, I think what RFK Jr. is doing right now is making us all vulnerable and dangerous.
What do you think can be done to fix this? What you see is making the Americans vulnerable?
You know, what we're talking about, there's 6 Democratic doctors in Congress, but I would hope the Republican doctors join us in calling for RFK Jr.'s resignation. We know what his belief system is. We know that he's just gotten rid of the top CDC scientists and doctors. It is putting us at risk. And again, vaccines are pretty settled science. We've seen the measles outbreak that has recurred in parts of the South. You know, now what's going to happen with folks that are vulnerable who want their COVID vaccines? Again, you know, I think he is putting us all at risk.
And there's still major questions about whether or not these shots will be covered by insurance. The White House says that people will still be able to get the vaccine if they want to. They say they still believe in individual choice, but still not clear if insurance will be covering this. What do you make of that?
You know, I think that's dangerous as well. You know, we should want folks, particularly folks that are over 65, that have chronic conditions and are vulnerable, we should make those vaccines readily available for them. The same thing with the flu shot. What we also worry about is he's really done an overhaul of the vaccine advisory board at the CDC, the folks that make recommendations on what flu viruses we should be going after and what constitutes this year's flu vaccine. Again, I want to rely on American scientists, American doctors, but if we can't trust what's coming out of the CDC, we're going to have to look elsewhere in the world to get that science.
So after what we saw last week at the CDC, what's your biggest fear going forward about how Americans see the CDC?
I mean, there was already post-COVID some mistrust of the CDC. Again, I thought they did their job in terms of putting out the science. Maybe they could have messaged better, et cetera. Now what he's going to do is erode trust in what is the preeminent public health resource in the entire world. I think that's dangerous. It is going to take us a while to rebuild that trust. Again, I would hope that the House of Medicine, all doctors come together to denounce what's happening at CDC.
It's Labor Day weekend. Fall is around the corner. Some say fall is just days away. We have flu season, COVID season coming up. This is the time when many Americans decide to get their vaccines. What do you advise them to do? How should they get information on what they should do for themselves?
I mean, right now, I would, with the folks that RFK Jr. is putting in place at the head of the CDC, his loyalists, I would actually urge America's patients to go talk to their doctors, get the advice directly from their physicians and healthcare professionals.
Congressman Bera, thank you very much for your time.
Thank you. Be well.